Hello, I'm Brenda Ramirez. I'm a family nurse practitioner nursing student from United States University. I will be taking care of you today. I will be performing a complete health history, but before I begin, do I have consent from you to record this assessment?
Yes.
Can I have your full name and date of birth?
Felipe Ramirez, 1 May 1989.
So you're about 29 years of age?
Yes.
All right, because it's your first visit, I'm just trying to get a better understanding of who you are as a person and overall history. Therefore, I'll be asking you several questions. It should take no more than 40 minutes.
Okay.
What's your gender?
Male.
Where do you currently reside?
Las Vegas.
What's your race?
I'm Hispanic. I was born in Colombia and raised in Las Vegas.
I was also raised in Las Vegas. What do you do for work?
Mainly desk work. Work 5 days a week, 12-hour shifts, mainly behind the desk.
Are you married?
Yes, I'm married with 2 beautiful daughters who I had to bring to my appointment because my wife's working.
Congratulations, you're very well behaved.
Thanks.
So tell me, what brings you in today?
So I'm here for my annual physical, but also trying to follow up on my constipation. I haven't been able to have a bowel movement recently, and my stomach feels awful.
Oh no, I'm sorry to hear about your upset stomach. That must be very hard on you today. Do you have stomach pain?
Yes.
And where's the stomach pain coming from?
Mainly in the lower left abdominal region.
How would you describe your pain? As sharp, dull?
Sharp.
Sharp.
Yeah.
And can you rate your stomach pain from a 0 to 10, 10 being the worst pain possible?
About a 6.
Oh, I'm sorry to hear about that pain. Hopefully we can take care of that. When did the stomach pain begin?
About 2 days ago.
Has the stomach pain continued?
Yes, I tried going to the bathroom, but I just can't seem to have a bowel movement.
And your stomach hurts all the time?
No, it's like on and off for the past 2 days.
And when was the last time you had a bowel movement?
About 4 days ago.
4 days ago. Did the stomach pain start without injury to the stomach, or you had some kind of trauma?
No.
No. Does the pain radiate to one side?
No.
Is there a certain setting that contributes to onset of pain, makes it worse, such as personal activities?
No.
Is there anything that makes the pain better or worse?
I tried putting some hot compression on it just to kind of alleviate the pain.
Mm-hmm. And it's alleviating the pain?
Yeah.
Are you taking any medications to help treat the pain?
No.
Have you noticed any symptoms that accompany the pain?
No.
Can you describe your last stool?
It was pretty normal, nothing out of the ordinary.
Yeah. Was it easy to pass?
Yes.
No pain?
No pain.
Do you have any blood loss? Or
No.
have you had any blood loss?
No.
Are you passing gas from both ends?
Yes.
Do you feel nauseous?
No.
Have you been vomiting?
No.
Difficulty swallowing?
No.
Have you had heartburn?
No.
How has your appetite been in the past week?
Still about the same.
How often do you normally have a bowel movement?
At least once a day.
Yeah, once a day. Do you normally have constipation?
I've had issues with bowel movements ever since I stopped exercising about 2 years ago. And my primary care provider who encouraged me to walk around and drink fluids. But when we moved back to Las Vegas, it just stopped. I just got lazy and complacent.
So the fluid intake and the walking around helped?
Yes.
Are you able to get around with the constipation?
Yeah, but it's a little bit uncomfortable.
Okay, now I'm going to ask you a little bit about your medications. Do you take any over-the-counter or prescribed medications to treat your pain?
No.
Do you take any tea supplements?
No.
Any vitamin supplements? No. Any herbal supplements? No. Okay. And do you have any allergies to food?
No.
Allergies to latex?
No.
Do you have reaction to dust?
No.
Seasonal allergies? No. And no environmental allergies?
No.
And no penicillin?
No.
Okay. Past medical history. I'm going to ask about just any history to get more knowledge about who you are as a person. Any history of childhood illnesses?
No, I was pretty healthy as a kid.
No. No chickenpox, measles? Any history of adult illnesses such as HIV, diabetes, hypertension, cardiovascular? No. Just the constipation?
Yeah, it's just constipation.
Okay. Do you have any surgical history?
No.
Are you in a monogamous relationship with one person?
Yes, with my lovely wife who I've been married for 10 years.
Oh, congratulations. That's a good amount of time. Have you been tested for STDs?
Yeah, so I actually got tested right before coming to Las Vegas and everything came back normal.
Yeah, and you don't have any history
No.
of that? Okay. Do you perform regular testicular exams?
Yeah, so my primary care provider told me that I should be performing testicular exams like while I'm showering and things like that, making sure nothing changes.
It sounds like your primary care provider was really on it. Hopefully, I can keep up with her. If she's her. Any plans on having more kids?
Yes.
Yeah, okay. Any psychiatric history?
No.
Any history of depression, anxiety? Have you had suicidal thoughts, thinking about suicide? Have you ever been diagnosed with a mental health condition?
No.
Have you noticed any changes in your sleep?
No.
How many hours of sleep do you get a night?
Normally about 8 hours of sleep. I have a pretty good schedule.
Yeah, and you feel safe at home?
Yes.
For immunizations, I'm just going to ask you about your immunizations. Are your immunizations current?
Yes.
Yeah. Do you have a copy of your immunizations?
Yes, I brought it here.
Oh, good. Wow, you brought all of them and even your childhood immunizations. It looks like your flu vaccine's up to date. Your PPD came back negative. Okay, I'm going to be taking a copy of this and then I'll give it back to you.
Okay.
For family history, I'm going to ask you from 3 generations. That could be your brother, your sister, your mom, your dad, or your grandparents, and any kind of conditions. So does your family have any health conditions that you know of?
No.
Anyone else in your family have constipation?
No.
Obesity?
No.
History of cancer like colorectal, breast, testicular, prostate, cervical?
No.
No. Asthma?
No.
Tuberculosis?
No.
Lung disease?
No.
Hypertension?
No.
Coronary artery disease?
No.
High cholesterol?
No.
Diabetes?
No.
Thyroid issues?
No.
Renal disease?
No.
Arthritis?
No.
Headaches?
No.
Seizures?
No.
Mental illness?
No.
Do any of your relatives have addiction problems?
No.
Substance abuse? Allergies? No. And what's your highest level of education?
I'm actually currently in college.
Good. And what do you study?
I'm going for my associate's degree in logistics supply chain management.
Oh, that sounds very stressful. How are you dealing with the stress?
I normally would go out and exercise, but ever since the move, I've been kind of just trying to adjust.
Oh, I'm sorry to hear about this big lifestyle changes. Have you tried to do other activities to help relieve the stress?
I started reading again. That was something that I would like to do to get my mind off of work. Hanging out with my wife and my kids, also release my stress.
It sounds like work is very stressful for you.
It's not really stressful. It's just something I think about just because I want to progress in my job and my company. It's just something. So just reading a book or watching a movie is nice to help think about something else.
Yeah, I also like watching movies sometimes to help relieve any stress that I have. How do you feel after you watch the movie?
Pretty relaxed.
Yeah. Does anyone else other than your wife and daughter live at home with you?
No, it's just us.
Yeah. Now I'm just going to get an idea about your diet and nutrition. Can you give me an overview about your food intake in the past 24 hours?
Yeah, so I woke up and ate a pizza, and then I grabbed the chocolate snack right before heading out the door. And then for lunch, I pretty much worked through lunch. So then I just grabbed the snack from the vending machine. And then I got off pretty late, so I was kind of tired and just decided to stop at McDonald's, grab food for the family. I ate about 2 Big Macs and some French fries, but I didn't have any sodas or juices or anything. I just had black coffee.
Yeah, staying away from sugary drinks is a great start. I can give you some more information on what a well-balanced diet looks like. For example, many starchy foods break down into glucose in the body, just like pasta. So you can eat those with moderation, but some people feel better with limiting starches, increasing protein, and increasing vegetables. There's also a great tool, MyPlate, which I have in the back. I'm going to be going over that later with you. And it gives you an idea of what a balanced